How's everybody doing? Nice to see everybody. I'm Jake Frabody, one of the wellness coordinators here, and I have the honor of officially introducing our new manager, Melissa Boguslawski. So she'll be leading our next segment on school advocacy. So I'm going to introduce Melissa and kind of tell you a little bit about her background before she takes it away. Melissa became the Project Healthy Schools manager in the summer of 2021, so this past summer recently. She came to PHS with 10 years of public health work, leadership experience, and involvement in conducting school-based child and adolescent programming and research studies in various demographics across Michigan, Mississippi, Indiana, and Florida. Her work encompasses considerable knowledge about building community relationships, fostering cross-sector partnerships and strategic planning, as well as successful grant writing and grant management efforts. Melissa's education includes a doctorate in health behavior and a minor in educational leadership and law, as well as a master's of public health and a bachelor's of science in exercise and health science. So without further ado, Melissa will take it away.
Awesome. Thanks so much, Jacob. And thanks again, everybody, for being here with us this morning. I'm looking forward to having you all continue to learn from us. I will do my best to follow up with Lizelle after her awesome presentation this morning, and we'll go ahead and get started. So I'm going to go ahead and expand my screen just a little bit so I can see everyone and make sure I can see the chat box. Jacob's going to be wonderful, and keep an eye on that too. Okay, so what we're going to be focusing on today, or for this second session, is how to be an effective advocate. So oftentimes the word advocacy can be a little scary. It may seem a little far-fetched, especially for those of us in a school-based setting. And so what I want to spend some time on this morning is just to give you all some tangible tools and resources. I'll make sure to include those in the chat box afterwards, so that we can feel a little bit more better prepared when it comes to advocating for school health, whether it's physical activity, health education, nutrition, whatever the tenet of school health that we're looking to advocate for. Okay, so a few learning objectives for this morning. We are first going to define advocacy and the importance of engaging in advocacy. And again, this morning we're going to be talking about the different levels of advocacy. So maybe you feel really comfortable at the local level, and we'll give some examples there. Maybe you're feeling like, ready to take the next step and maybe advocate at the state or federal level. We'll also talk about those options as well. But also, talking about the importance of being an advocate in whatever kind of way it's most comfortable for you. And I'll show a few examples of what effective advocacy strategies look like, and then we'll also work together as a group towards the end of my presentation to develop an advocacy strategy for a particular scenario that is actually pretty prevalent in our schools today, our schools here in Michigan. So the first question I'd like to ask everybody, and if you can just put your answer or your response in the chat box, is what is advocacy? So when you hear that word, hear advocacy, what comes to mind? So it can be a particular role or position, it can be an action. What comes to mind when you hear advocacy? And I'll give you guys just a few minutes to put your answer in the chat box. So it can be anything that you think of. Speaking out, good support, speaking out. Awesome. Great, your voice matters. Standing up for student needs. Having a right, yep, absolutely. Great answers, everyone. Being a positive influence, sharing knowledge. Great. All wonderful examples. Thanks, everybody. Awesome. Yep. So that you guys are nailing it with those examples or in kind of your personal definitions of advocacy. So when we talk about advocacy, I'll just expand on some of those great definitions that you all gave. It's an action, taken to support or oppose a cause, person, or a proposal. So it is definitely an action to take. We know with our national health education standards that advocacy is actually one of the 8 national health education standards. It's one of those skill-based health education health skills that we hope that our students have by the time that they graduate high school. It's an essential component. A lot of you mentioned this. It's an essential component to raising awareness Educating others and driving change. So all of us as educators, we have a really great kind of a upper hand on people because we already are educators as a profession. So you have that skill set and knowledge on how to effectively communicate and educate others in a way that can drive change in our communities at a state or at the federal level. And again, it's simply a way to educate others about a specific point of view. So using facts or data, and then encouraging stakeholders and whoever our audience is to support the issue that we have that we've presented to them. So a few examples of what advocacy is, what it might look like. So again, oftentimes if I'm speaking with an audience, they may say it's lobbying for something, which that's true. So we can say that all lobbyists are activists or are advocates, but not all advocates are lobbyists. So you don't have to march up to a state legislature. You don't have to go over to Washington, D.C. to be an advocate. You can do it at all different levels and still be very effective. And so advocacy, we can contact an elected official, whether it's through email, by mail, or leaving them a voicemail, or if you get a chance to talk on the phone with them, speaking at a school board meeting, meeting with school administrators, sharing information on social media platforms. We'll show some ways and efforts that you can do that later on in the presentation. Attending a march or a protest, and even participating in a committee or a coalition whose mission is to bring about a specific change. And so we can think about different coalitions and different committees that have particular kind of action items and action steps that they like to take, causes that they want to champion for their communities, for their students, children, whoever it might be. And so those are all examples of advocacy. This list is obviously not all that you can do. And again, we'll look at some other tangible examples later on in the presentation. Excuse me. So why is it important to become an advocate? So if school health is important to you, then you can and should be an advocate. And we say this because of school health advocates, decision makers learn why health-related policies and practices support both student health and academic achievement. And so those of us in the school setting, those of us who have a background in school health, whether it's physical education, health education, nutrition education, whatever the case may be, mental health, like Lizelle spoke earlier, if we have an interest in that, we're the experts in that field. And oftentimes our decision makers, so those at the local, the state, and the federal level, may not have the know-how and the knowledge and skill that we do when it comes to the importance of student social, emotional, mental, and physical health. And especially not maybe understanding that direct connection that health and learning has with one another. So, Lizelle, we wanted to take the information that she gave about the importance of recognizing, the signs of depression in our students. We can't assume that local, state, or federal policymakers know those signs and the importance of recognizing those signs as well. And so as professionals in our field, it's really important for us to know how to better communicate and offer that information to stakeholders so that they can better understand the connection between the decisions that they're making when it comes to policies and programs, and then how those decisions can influence the health and then in turn the academic outcomes of the students that we're serving. And then again, an advocate's passion and knowledge can influence outcomes. So if you're very passionate, you're all wellness champions with us, so you're obviously passionate about health. So if you have a passion for health, if you're really passionate about making sure that your students are eating well when they're at school, if you want to get better social emotional learning resources into your school, if you want to make sure that we are saving that time for recess for our students, if you're passionate about that, that's going to speak through the messaging that you give to those stakeholders that you meet with, and that can be really influential as well when it comes to those decisions that can be made at those different levels. So a few things. So what we'll do is kind of just go step by step in terms of what we can do to prepare to advocate. So the first thing that we want to make sure that we do is identify our goal. And so we talk about goal setting in the PHS curriculum. So we can do that for ourselves as well when we're advocating or preparing to advocate. So the goal that we have is the short or long-term result that we want to see in terms of an issue that we have identified. And of course, like any wonderful goal, it should be smart, measurable, and realistic. Okay. And then from after we identify our goal, what is our issue that we're trying to tackle? So the issue, when we talk about that, is the subject matter that you're focusing your education efforts on, or the problem that you're seeking to rectify. So when I asked you all what advocacy was, a few of you mentioned problem solving, shedding light on an issue, and that's exactly what it is. And so when we have our issue, once we identify it, we want to make sure that we gather enough data and facts, not too much to where we overwhelm our stakeholders, just enough data and facts, especially if we can find that data that's applicable to our student population. And then establish 2 or 3 key talking points about the issue, including your ask that will help achieve your goal. When we are working with stakeholders, whether it is our school board members, a local representative, whoever it is, they typically have a lot coming at them in terms of information. So if we can narrow down those 2 or 3 key talking points, including our ask, we want to be upfront, we want to be direct and saying, here's what we're asking for. The better we can be when it comes to continuing on that conversation. So be ready to have that ask right up front if you're able to secure time to meet with a representative. So when we have our goal and we have those issues identified, we then want to think about what's going to be the best way for us to advocate. And so again, it may be participating in a public stakeholder meeting. We might want to meet with school administrators or elected officials. We may, again, want to share information about the issue via social media, writing an op-ed if you feel comfortable doing that. Again, if you have any speaking opportunities to educate on the issue and advocate for the goal that you have set. And so again, there's different ways that we can go about advocating when it comes to meeting that goal that will address the issues that we've identified. So again, if you're a really great writer and you're very passionate about a topic area, write a letter to your local representative, write a letter, see if you can write an op-ed in your local newspaper or on an online journal, whatever the case may be. But there's a lot of opportunities where you can use your skills that you have. If you're really savvy on Twitter and on social media and you have really great access to resources, you can just use that as a platform to share information to educate the people around you about a particular issue that you've identified. So when we're talking about advocating, and this was where we want to make sure that we know kind of what level we want to work with. After we determine our goal, we want to see is this something that's going to be able to be achieved at the local, at the state, or at the federal level? Once we identify whether we're working at the local, the state, or the federal level, we can then get a little bit more creative with how we want to address and have those needs address that issue. So, for example, if we have a curriculum issue, so if we need an update in curriculum, or we're trying to get get a curriculum integrated into the classroom, it may or may not be within a principal's locus of control. If not, you may need to take your efforts to the district level. In some states, you may have textbooks and curriculum that are mandated by the state, so it may be important to know that. But if you're trying to get some updated curriculum, so whether it's getting updated social emotional learning curriculum into the classroom, whether it's incorporating other subjects into the school day, having that instructional time, it may be above the principal's head, and you may just need to go a step further and talk to your school district. If we're looking to increase funding for mental health services, for example, for local school districts, they may end up having to go up to the state level because that's who appropriates all the money to our local school districts. That comes from the state. So then once we can identify the direction that we want to go in when it comes to advocacy, we want to think about our timeline and our process that we need to achieve the goal that we want to set. And so again, we want to be flexible. So when it comes to advocacy efforts, we want to make sure that we're flexible. We understand the process and the timeline and the time that's required. We always want to give ourselves more time than we think. And again, being flexible, if you set a meeting, it may get pushed back, it may get canceled, especially in the era that we're in with virtual meetings and school districts being pulled and teachers and administrators being pulled into a bunch of different directions. It's important to be flexible. And again, if we have to extend a timeline, that's okay too. But it's just staying persistent when it comes to achieving the goal that we have set. So when we are talking about decision makers and who influences those identified decision makers, so I've mentioned a few. So we may have, again, our school principals, we may have our superintendents and our school board. You could have at the state level, but then they typically listen to other people. And so when we're talking about engaging with our stakeholders, we want to make sure that we can determine what's going to be the best way to reach out to them and communicate with them. So whether it's an in-person meeting or a Zoom meeting, drafting a letter, sending an email, whatever's going to be the best first form of communication. But then we want to think about who is it that influences their decision making. So if we're talking to our principal, for example, saying that we want to adopt this awesome new program for student health and wellness, they may need to answer to the school district. So we want to see what are the priorities of the school district, what are they looking to achieve, what are their main priorities, and then having that conversation with them so that we can have their support to influence the decision making of the school principal. Again, hopefully politics aren't too heavily involved at the local level. We know that at the state and especially at the federal level, politicking can get very tricky. But we also want to keep in mind our message in terms of the importance of our message when it comes to what we're advocating for. And so when we're talking about local, state, and federal advocacy, we again want to make sure to remember that regardless of what level we're working at, that there's a big impact for health and welfare of students, schools, and communities, regardless of what level we're working at. And so what we'll do is take a look at some examples of local advocacy. So just for me to pause and ask you all a question. So when it comes to local advocacy and communicating either with your board, your city council, or with your school district, what are some things recently that have been brought up to your local, so your local governing body? So from a school perspective, what have been some topics or issues that have been brought up to either your school district, your principal, your city council when it comes to the health and well-being of your students, if you can think of anything? What are some topics that have been brought up in conversation, or maybe that you've heard that have been brought up to your school board, your principal, or just among your school community? Social emotional learning, good mask usage. Yep. So especially if I were to ask this question any time of the year and any other different year, we may have different topics, but we know the big topic of conversation right now is mask wearing. We're seeing a lot of mental health of students. So like Lizelle was mentioning in her conversation as well, teacher health, absolutely. We were talking earlier in conversation about the shortage of substitute teachers as well. Bonds, again, masks and hygiene, absolutely. So again, if I were to ask this question next year, it may be a whole different set of different conversations that are being had. Thank you, everyone. So when we have these conversations at the local level, so thinking about what's going to impact our students directly on a day-to-day basis or impact our teachers on a day-to-day basis, this can go, again, anywhere from our classroom to our school, all the way up to maybe to our city or our county government. And so when we think about those decision makers, that may include a board of education, again, our city council, county commissioners, anybody that falls under that category. And so when we support local advocacy efforts, we can also get support from community organizations, faith-based communities, PTAs, student groups, and other professional organizations. So and that's another thing to think about, is don't feel like you have to go into advocacy efforts on your own. There are typically a lot of people who may support the cause that you're championing, and it's just finding those people. And so an example that I love to give in terms of local advocacy efforts, and there are probably plenty more out around the community, especially in the state of Michigan, that could be great examples of local advocacy. So as an example, so this is out in New Mexico, but I love this example primarily because it involves a Winnebago named Flo. So Out in New Mexico, a school nurse named Lisa Patch. I've actually had the opportunity to have a few conversations with her, and she's lovely. But at the beginning of the pandemic, so last year, she was able to use some of the CARES Act funding to purchase a 40-foot Winnebago for her students. And a mobile nurses station is what she ended up turning it into. And so a little background about her school. So she works in almost entirely Title I school and serves a population that's 42% Hispanic. And so with her district's purchase of Flo the Winnebago, we can see that even in just a few months, Flo the Winnebago had a really big impact on their local community. So she was able to administer flu shots with partnering with the local health department out in New Mexico. She was also able to help with contact tracing. An update from her is they actually were able to take some of that CARES Act funding and get proper refrigeration in Flo so that they now have access to the COVID vaccine as well. So they're able to travel to students and their families. They were also able to travel distributing food boxes to hungry kids and families. So going back to those basic needs of students, just having our students being fed while they're at home. We know that a lot of our students get breakfast and get lunch at school. So when everybody was sent home, that was a major concern across the country. And so that was an interesting and in a unique way that this school decided to go ahead and meet those needs of the students and their families. They were also able to distribute desks. So remember the desk shortage that happened at the beginning of last spring. And they were able to provide hundreds of COVID tests to that school community. So again, it wasn't any big push in policy. It was just advocating, saying, hey, we have this CARES Act funding. What's a way that we can meet the needs of our students? And every school may not need to purchase a Winnebago and drive around the community, but recognizing the specific needs of this district in New Mexico, lower income community, bringing the resources to students, to their families. And that was a way that we got to meet some of the needs that came to at home learning. It also helped again with food distribution, flu shots, COVID testing. And again, as an update from Nurse Pat, she also let us know that they used some of the funding again for that refrigeration for the COVID vaccine. So they're able to now administer the vaccine through the health department if they need to travel to certain communities across their district. So then state advocacy. So this one will probably be a little bit more impactful, influential based on conversations I was asking our team in terms of some of the things that are topics of conversation for our wellness champions, and what we hear are some of the things that we'd like to work on here in the state of Michigan. And so when we work up to the state advocacy level, we would like to have, again, a change in regulation or law that impacts the entire state. So whether it's all teachers, all students, all school districts. Again, so that would be our state boards of health or education, secretaries or commissioners, leadership of state assembly, and even working our way up to the governor if we can. And so when we talk about state advocacy efforts, typically this is efforts conducted by many school districts, coalitions, a statewide organization, so that we're able to get more of that buy-in and understand that it's a topic of interest and the issue is impacting all communities across the state of Michigan. So an example would be school wellness policies. So I would love to hear, or you can either just put in the chat box or use one of the emojis, how many of your schools have an up-to-date school wellness policy? So if you think about it, how many of you, and it's okay if you don't, but this is a piece of information I wanted to make sure that I share with you all. And again, and us as PHS, all the coordinators, we would be thrilled to be able to help you all when updating those wellness policies if they need some work. So I'll take a second to stop chit-chatting, but in the chat box, if you want to say, yes, we do, or I have no idea if we even have one, that's okay too. Let's see. Great. That is awesome. Awesome. Wonderful. Great to hear. And again, if you're like, I'm not sure, that's okay too. We're here to help with that as well. Let's see. Needs an update for sure. Well, you needs a total makeover. Well, we are going to make sure you write your names down, Andrea and Brian, and we are happy to offer that support if you would like it. So So when it comes to our model local wellness policy, it is actually required by the state to have a local wellness policy. And let me make sure I'm not missing anybody in the chat box. Thanks, Jacob. So the local school wellness policy was established when we had the reauthorization of the Child Nutrition and WIC Act, when we reauthorize it, and we know it now as the Healthy Hunger Free Kids Act. Excuse me. So any school that takes any money from the school breakfast or school lunch program, that receives any money from the USDA, they are then required to develop a local school wellness policy that promotes health of their students to address the growing problem of childhood obesity. There's now even conversation about potentially updating those policies and to also implement mental health programming and practices. We're kind of keeping an ear and an eye on that one. So and why it's important to have that local wellness policy is because every school district is different. And so we don't want to have one general wellness policy for the state of Michigan, because what our urban schools need may be very different from what our rural and our suburban schools need. And so it's best practice to have every district have their own local wellness policy, because they understand the needs of their students more than the state of Michigan probably does, because we have that one-on-one contact and interaction with our students on a daily basis. So just a few things that's required in the district wellness policy are to have specific goals for nutrition promotion and education, physical activity, and other school-based activities, standards for nutrition guidelines for all food and beverages available. So that's not only school breakfast and school lunch, but making sure that snacks are also in line with the Smart Snacks in School guidelines from USDA. And then also having health promotion initiatives in the district wellness policy as well. And with the update from Healthy Hunger Free Kids Act, it's actually through federal government. It should be evaluated every couple of years. So again, those of you who are saying, it might need some work. Again, we're more than happy to help you all if you would like us to take a look at that, see if any updates or revisions need to be made for your local wellness policy. So again, the unfortunate side of local wellness policy is that there's no money behind it. So the state's not coming around and knocking on school doors and saying, hey, let's see your local wellness policy, but we know how important that they are, and to make sure that they're evaluated, and make sure that we're continuing to update and make sure that we're meeting the health and wellness needs of our students and our staff within the school setting. Okay, so federal advocacy. So this is when we've heard lots of things about appropriations and bills and all that jazz over the past couple of years, but just wanted to show a few examples of what that looks like when it comes to the field and the area of school health, physical activity, nutrition, mental health, all those wonderful things that should be just woven into the day-to-day of our schools. And so again, just as we work up the continuum, when we have federal advocacy, this is when we want to impact federal legislation, regulations, and programs at the national level. So with education, it can be a little tricky sometimes because education does not have the biggest budget at the federal level. Most of the funding comes from the state level. We get anywhere from about 9 to 10% of the federal government's budget is allocated to education every year. We would love it for it to be more. But we're working typically about 9 to 10% of the federal budget. So when we're thinking about our federal decision makers, again, that can be agency secretaries, so USDA, USDE, leaders of any federal programs, of course, our representatives and senators, chairs of any committees, so on and so forth. And so when we have our federal advocacy efforts, we're typically focusing a little bit more on bigger picture issues, so maybe not as specific, because when we are talking about big picture, we want to make sure that it's equitable across all the states. So we know what our students in Michigan need in terms of specifics, but we're looking at a federal, from a federal landscape, it just might have to be a little bit more broad in terms of what our asks are. So the example I want to give here and kind of give some insight on what's being worked on right now, and I'll provide a few resources and links for you all towards the end of the presentation if you want to just follow up. So everyone's probably at least familiar with the Every Student Succeeds Act also. So we say it's It was formerly known as No Child Left Behind. So there were some updates made with ESSA, including how some of the block grant funding works. So there's some restructuring of block grant funding, but what was great news for those of us in school health, those of us who are advocates for health and physical education, was that for the first time in the existence of the Elementary and Secondary Education Act, health was included in part of a well-rounded education. And so we don't have core curriculum, but now we have what we call a well-rounded education. And again, it was the first time that health and physical education was mentioned in the same breath as STEM, arts, civics, and our AP classes. So that's a great win for those of us in health and physical education. When we have our block grant funding, so you're all familiar probably with Title I, and then Title IV Part A is what we focus on a lot when it comes to school health, particularly health and PE, because that's where we can get a good chunk of money. So right now, up until the end of this fiscal year, the federal government has authorized $1.6 billion. So right now, the current proposed allocation for funds moving forward is actually less at $1.22 billion. It's still a lot of money, but when we're looking at that for all students across this country, it's not a really big pot of money. So what we're advocating for, so I'm a member of the American School Health Association, our Advocacy and Coalitions Committee. So we've actually had the opportunity to meet with a few committees at the federal level, including the Appropriations Committee, as well as the House Education and Labor's Committee. And so what we do when we have these meetings is we present data and we present facts and information to encourage them to expand that budget. So we're actually encouraging them and advocating for a $2 billion budget, especially after the past few years and seeing the important role that schools play when it comes to health, physical education, mental health, and all those resources. So when we talk about what's allowed under Title IV Part A, we can see number one is providing students with a well-rounded education. So I have bolded health and physical education, not that the other subjects aren't important, but again, health and PE is part of that well-rounded education. Supporting safe and healthy students. So that is a priority of this block grant funding. So again, school mental health, drug and violence prevention, trauma-informed practices, and then health and physical education again. And then again, supporting the effective use of technology, whether it's professional development, improving technology devices, blended learning. This has been in there since, since this was updated back in 2015. We know that blended learning and technology is something that we really need to focus on, especially after the past year and a half. So what we can advocate for, and this can be something of contacting and having conversations with our elected officials that serve us in Washington, D.C., is to say thank you for your support of the new budget, but here's why we're proposing $2 billion for this block grant funding versus the 1.22 that you're proposing. So conversations, those are usually had as a group. So again, I'm not having the personal conversations. I'm going as a representative of the American School Health Association. But you can also do that through the National Education Association. We have school nurses through the National School Nurse Association that also advocate at that level as well. So what we can do a lot though is get data and stories and information from people like our wellness champions who can give real life examples of how this funding could impact schools and the students that you all serve. So before we get to our example, always love to show our whole school, whole community, whole child models. This is from ASCD and the CDC. And so when we're talking about student health and school health, understanding the importance of all 10 of these different components. So here at PHS, we focus strongly on physical education, physical activity, the nutrition environment and nutrition services, health education, family engagement. And so we want to make sure that we're incorporating all of those pieces to make sure that we're giving our students a safe and healthy school environment, which then in turn can help them achieve academic. Okay, so some ways for us to advocate in 1 hour or less. We are all pressed for time. We all don't have a lot of time throughout the day. Time management could be a skill that many of us can work on, or because as wellness champions, as teachers, your plates are banquet tables at this point. So Some ways that you can advocate that doesn't take a lot of time. So for an example, if you have 1 minute, you can check out the CDC's Parents for Healthy Schools resources, or you can come onto the PHS portal and look at the parent resources that we have. In 3 minutes, you can post a healthy recipe on your school health website. So if you have access to your school district's website or have communication with the person that does, you can say, hey, here are some healthy Thanksgiving recipes. Here are some healthy holiday recipes. In 10 minutes, you can write a letter and email to an elected official. In 15 minutes, you can create a flyer, a pamphlet, or a poster on healthy eating to distribute for a back to school night or an event. If you have 45 minutes, you can schedule time to meet with elected officials or your school board. And then if you have a whole hour, you can write a letter and of a publication to support healthy eating in schools, or even have it be write a letter as a group. So as parents, as wellness champions, as teachers, whatever your role is, you can also do that as well. So again, with advocacy, the thing I like to drive home with this presentation is that it can be, you might think it's small, but you're educating of the people around you, and those that you have within your circle can be really impactful, because then they might share it with somebody, and it can be a really great trickle down effect in terms of getting the information to people and educating our communities in terms on those topics and issues that are really important. So a resource that I'm going to share with everybody is a toolkit from the American School Health Association. So I just wanted to show a few examples. So in the toolkit that we have through the School Health Association, we have different templates and tips that you can use for social media. So how to tweet at certain people. There's also resources on how to look up your local or state representatives. And so social media, of course, it can be a platform to reach out directly. So everybody can be found on social media if they're there. And so that's a way to use effectively use social media. And we can even also write templates for meetings. So again, writing those letters in the resource I'm going to give you all. We have templates that are ready to go. You just have to fill in and use those talking points to help address the needs of your community. Okay, so I'm going to give just a few minutes to give us an advocacy scenario. So what I'd love to do for the last time that we have together is to walk through this scenario. So I'll give everybody just a few minutes to read through this. And then there's a second slide as well. But we'll give you guys just a few minutes to read through this scenario, and then we'll have some follow-up questions on what may we want to do based on some of the best practices for advocacy, some of those small steps that we can take. What can we do for this particular scenario that we're seeing play out? So it's about a student named Eli who moved to a new school in Michigan. And since moving to this new school, his mom has said that he's always up out of his seat. He's talking to his classmates and he's getting into trouble. But his mom said he's never like that. He hasn't been like that before. But she realized that his new school where he's moved to does not offer students enough time for gym class or recess. Okay, so in Eli's new elementary school, his school is one of 50 without a gym teacher. Okay, out of the 106 schools in his district, only 56 of those schools have one full-time teacher. And then in the state of Michigan, there actually aren't any laws requiring schools to offer recess. As for PE, schools are required to offer the class, but the amount of time is not specified, which means like some kids like Eli might go once a month or less without PE. Okay, so to expand on Eli's new district, it's not the only district that's cut back on PE teachers in recent years. We know that schools are heavily judged on standardized test performance. So some schools have focused on their resource on core subjects, cutting out things like the arts and gym and recess to make more time for instruction and test prep. So students are given 45 minutes to eat, that should be eat, not each, to eat lunch. And if they finish early, they're allowed to run with the other children who finish early. Okay, if they do not eat quickly to play quickly enough to play, they then don't get that time to exercise and burn off that energy. And his mom says that she can expect a call about his disruptive behavior if he doesn't eat fast enough to get outside. Okay, so from Eli's story, a few questions and things to consider. So after reading through Eli's story, and I'll kind of bounce back and forth and keep this up. After reading through this, what might be an issue that we have identified, or a few issues that we've identified within this particular scenario? What did you all see, or what did you pick up? Well, there's a couple to choose from. Let's see. Lack of physical, oh, they're coming in. All right, so lack of physical activity, more emphasis of PE, there's no physical education, no PE opportunities. Okay, so we'll stick with that one. So we need more physical education. I absolutely agree. Okay, so we'll point that issue. Okay, pull out to that issue. Okay, so what would be the goal then for us if we wanted to get more physical education into Eli's school or maybe his district? What would be the goal that we would want to set for ourselves? Based on some of the things we've talked about, what would be a goal that we would want to have? Mandate a required number of minutes per grade level per week. I like that, Jalinda. Any other? I love that. Any other recommendations? Set standards for the district? A PE teacher for every school? Great. Excellent. Love those goals. Okay. So do we think that these goals would then be addressed at the local, the state, or the federal level? What do we think in terms of either the number of minutes per week, or setting standards, or having a PE teacher for every school? Do we think that that would be more at the local, the state, or the federal level? So we can kind of state, local, school district. Let's see. State, good. Local and state, local and state. Yeah, so definitely depending. So we can start at the local, and then yeah, absolutely, Stephanie, it would be great to get absolutely, local needs to fix it, but unless it's forced to. So again, so we can start at local, and if we're not getting a lot of movement, then we can definitely move up to the state level. So what are the strategies that we can use to more effectively engage and gain support for our goals? So what strategies can we use? What partnerships can we develop to get some support to get a PE teacher into every school, and to maybe to let me make sure I'm saying this right, to set those standards for physical education time? Who or what are some conversations that we would need to have to get some more support behind us? Good. So write our local state officials, find out how many schools are getting gym and how many aren't. Absolutely, public awareness through social media, advocacy groups, go to board meetings and stress importance. Absolutely. Yeah, look at data from other local districts. So are there districts around us that are making it work, that do have enough PE teachers? Absolutely. So data is super important. Writing those letters, sharing public awareness through the media. Absolutely. All really great, good ideas there. Okay, so this is something to think about. So bring it up to the superintendent. Awesome. Get parents on board. Absolutely, Susan. So parents are a huge part of the school environment and the school community. So the more that we want them to get engaged, an opportunity to get engaged, I'm pretty sure most parents would have be able to be a huge voice to get more PE and exercise and for their kiddos throughout the school day. But then challenges, this is always something to think about too. So what challenges could we face when addressing this identified issue that we would like to bring up? Budget, yes, yes, yes. Lack of certified teachers. Great examples. Schedule, absolutely. Old school mentality from the board or superintendent, great answer. Stop the push for so much standardized testing. Yep, so the push for standardized testing, absolutely. So protecting that instructional time for PE, for physical activity focus is always on data for academics, and health is not always being looked at. Good, very good point, Susan. Great. So knowing these challenges, that's part of the battle too, is as we're planning this advocacy plan, as we're thinking about the steps that we want to take, knowing that we might have some challenges either right away or down the road, we're better able to prepare and plan how can we overcome those challenges, what are some resources or data or supports that we can have to address those challenges if and when, hopefully just if they come up or when they do arise. Okay, so then messaging. So that's going to be an important part for us. So what messaging would be needed to support this issue that we're addressing and to achieve our goal? So if we want to get more PE teachers into every school and to secure instructional time for PE, what's the kind of messaging that would be impactful to our superintendents and our school board members and those who are making the decision? So what would be the messaging that we could get across that would get their attention? So knowing what kind of the priorities are of that population, of our stakeholders, what kind of messaging? Yes, perfect, Nicole. Yeah, physical activity improves academic performance. Awesome. Physical activity helps brain function. You could ask Ben for the image of the brain scan, and that's a great resource to use. Stats about behavior and health. Absolutely, and there's tons of statistics and research out there. Do we want a healthier, sick society? Stress the importance of physical education, the correlation, activity, and brain. Awesome. The messaging needs to show current. Yeah, absolutely. So you guys are nailing it on the head. So knowing the emphasis that we have on health and education, of course, but knowing that, our stakeholders, our administrators, they can be focused. It's not that they don't care about health, but what they're focused on are those academic outcomes. But hey, physical education, we know that there's that direct connection between PE and academic performance. How can we, and then especially addressing the budget issue, thinking about, well, if, students are taken care of and they're missing school because they're not healthy, that can lead to decrease in attendance rates, which can lead to students not performing as well. So there's ways that we can talk about that. PE helps students understand how to work with others and diverse students. Absolutely. And there's also research coming out that physical education can help enhance social emotional learning as well. So that's another thing. It works on communication skills when kids are outside playing together, or they're, in gym class, communication skills and conflict resolution skills. All those skills can really be emphasized and built on when kids have the opportunity to be either in gym class or in recess together as well. Really great examples, everyone. Thank you. Okay, so a few resources, and again, this will all be for everyone to share, but I wanted to take a second just to at least share that advocacy toolkit with you all. So again, I'll put that in the chat box, and I can make sure that it's available as well on the portal in case you lose the link or whatever the case may be. So I'm just putting that in the chat box right now. So what you'll see here, and then I will make sure to leave a few minutes for questions as well. But again, this is a really great resource. And what I'm going to do is just kind of scroll down to the bottom of the resource where we have examples, but then towards the bottom, we have, those are our resources, oopsies. We have our templates that you all can use. So instead of kind of sitting back and not sure how to get started, we have our templates in terms of how to tweet, and then we have how to write an op-ed, how to find members of Congress on social media. We have how to write an op-ed. So there's some examples in there as well. And so again, a lot of the information that I shared with you all today is in here. But again, how to schedule a meeting. So again, if you're not sure where to start, this toolkit has some really great resources for you all to get started. If it's a first time for you, if you're not really sure what language to use, that information is all in there as well for you. And of course, we're always happy to help support, write a letter of support, whatever it is for you, if an advocacy effort is what you feel like your next step is as a wellness champion or as a school or as a school district. So I am going to take a pause and see if there are any questions from anybody, any comments if I can clarify anything, but I'll leave a few minutes for any questions from anybody.
All right, Melissa, you got me all riled up here. When you're talking about physical education minutes in our state, and I guess the lack of requirements for schools. So over the last few years, we've been fortunate to partner with some of our PHS schools, and we've hosted legislators at the schools. And in preparation for one, it's been a couple of years now, but I want to, if I may, just quickly share out something actually I put together. And if you take a look here at this Word document, state proficiency rankings for math and reading. This is data from 2016. And you can see the top states here. So Massachusetts kind of leads the league in proficiency rankings. Over 50% of students are proficient in math and reading. They spend, their per pupil spending is 8th. So if you look here, focus on the top 10, you can see that a lot of these top 10 states for proficiency rankings are not spending the most amount of dollars. But what are they doing? You can see these 1, 2s, and 3s here. So 1, that is a state requirement for elementary students to have physical education. 2, is a state requirement for middle school or junior high students to have and take physical education. And 3 is a high school requirement for physical education. So the top 10 states for proficiency rankings all have requirements for physical education, the elementary, middle, and high school levels. And it severely starts to drop off here. So you see us here, Michigan, 31% of our students are proficient in math and reading, although we've increased seat time for math and reading significantly over the last several years. But we have not added any more requirements other than that one high school requirement for physical education. And we can see that we're scoring 39. So although it's not a perfect correlation for physical education to high student achievement, it is certainly part of the recipe for success. So thought it was fit well. And I guess the message here is, if we can help support your advocacy efforts, we are more than willing to find data, find information to help you with whether you're advocating with a school administrator or at your school board meeting or within your local community, or if you're interested in a statewide effort. Healthy Kids, Healthy Michigan is a great coalition advocacy group here in the state. In fact, working with the state on beefing up those requirements for physical education across our state. So we have lots of resources and a lot of wonderful partners, one of which Shannon here from Blue Cross Blue Shield of Michigan. They offer a lot of advocacy resources as well. So if we can support your efforts, please do not hesitate to reach out to us, no matter how big or how small you think your effort is. Please rely on us to help you with those efforts. So.
Absolutely. And thanks for sharing that, Ben. That's a great resource and kind of visual to show, that correlation. Let's see. Yes. And so let's see, Eric. So although Michigan requires a PE credit, yes. And so that's a really great point too, is opt-out policy. So, if students are an athlete, they can opt out of that as well. And so how can we, better enhance those policies to make sure that students are getting that? So even if they play a sport, there are still other opportunities for them to learn other ways to be physically active as well. With the Title IV Part 8 funding, if you're not sure kind of what your school's getting, what they're allocating that for, what your district's allocating that for, I'm happy to help with that. Again, if anybody has any questions or would just like to kind of mull through things and see how you would like to advocate or kind of next steps, like I mentioned, please don't hesitate to reach out to your coordinator, myself, or anybody on the PHS team. We'd be thrilled to have you in whatever efforts you have for your school, your district, or we can take it big and go to the state level too. So thanks so much, everybody. I look forward to continuing to work with each of you. It's been It's an awesome past couple of months with the PHS team, and I'm looking forward to connecting with you all moving forward. Let's see. How would you suggest advocates for hiring new employees in their school for continue? That's a really great point, Heidi. And so there is data out there that's available in terms of teacher turnover, as well as making sure teacher employee data. And when you have fewer teachers and you have larger classroom sizes, how that can be detrimental to the student learning environment. And so if you wanted to put your information, and so then that could be just sharing that information, sharing that data, showing the numbers in terms of cost saving when you have, when you're having to constantly hire substitutes versus having that consistent teacher in the classroom. But if you wanted to put your email, or I can get it from the attendance list, I can send you some data and information that could be a good start to look at. Awesome. All right, everyone. Well, let me see. Don't want to miss any questions. Okay, PHS is helping us maintain our district policy. For real, PHS. We would love to be in every school. However, for real change to happen, is working with the state to make requirements. Yes, and so like Ben mentioned, I know he is an active member of Healthy Kids, Healthy Michigan. Because we're a 501c3, we can help so much as an organization in terms of lobbying, advocating, but we are absolutely happy to provide information. We can work as individuals, and so it's definitely something that we support. We can offer a letter of support, but we can offer that support as work as individuals. And so I know, Ben, how he mentioned he's part of Healthy Kids, Healthy Michigan. If we're members in other organizations, we can work through that as well. And so, yeah, we're always happy to share information, get data out, have those conversations with local policymakers, local representatives, to make sure that they have the most up-to-date information to make those better decisions for our students. I'm just trying to write, talk, and answer questions at the same time. Awesome. Let's see how we're. Yes, but I absolutely agree with you, Susan, that real change needs to happen across the state. So that is absolutely something we support, and we will continue to look ahead to see how we can continue to support those efforts as an organization. Awesome. Well, thanks so much, everybody, for being such an active and attentive audience. I appreciate it.